It's a real pleasure to be here today with you. I am so excited about this research day. I want to begin by congratulating Dr. Lupien for putting together a fabulous day, but also being such a tremendous ambassador on the topic of sex and gender. She could be our poster girl for the Institute of Gender and Health, really pushing the envelope in terms of our thinking about sex and gender, and particularly mental health. I've also had the pleasure of reading the abstracts for the posters, and I am so impressed by the quality of the work being done and really look forward to engaging with those of you who have posters. I think it really shows the science is moving forward in this area. I've learned a great deal already. My background is not in particular in the area of mental health. I'm a nurse by background and grew up thinking about public health issues and also disease prevention, health promotion, and became interested in both women's health and sex and gender differences, as Sonia indicated. Today, Sonia's stolen a little bit of my thunder because I'm going to talk a little bit about sex and gender and what they are and how we begin to conceptualize them. I'm going to draw some distinctions in terms of thinking about their relationships, and hopefully get you to begin to think about your own work in new ways in relation to sex and gender. I called my talk From Neurons to Neighbourhoods because I think it's really important for us to think about moving from the cellular level to a social level. And that's, I think, the challenge of new science, is to be thinking about new models, about how we can actually move. We've talked for a long time about thinking about genetics, for example, and how environmental factors affect people genetically. But I think in terms of sex and gender, we also need to be moving that model forward, thinking about our work in new ways. So that's who I am, and I do encourage you to get in touch with me, to talk to me if you have ideas about the Institute of Gender and Health. I've been in the position for about 1 year and 3 months, and it's been a real pleasure to be getting to know scientists in the area, to be talking about their work. We love to highlight new findings. We'd love to hear about your work, so please stay in touch with the Institute. We really do look forward to hearing from you. So I've told you a little bit about my objectives, and I really see actually the field of gender, sex, and health as moving forward. I think we're really on the cusp of a lot of very exciting work in this area, and it's really fun to be thinking about how this field is going to be growing over the next several years. So I'm very pleased to welcome you on board and to be thinking about sex and gender differences, and I'm going to be talking a bit about why this area is very important. I'm also going to talk a little bit about the mission of the Institute of Gender and Health. Some of you might not know a lot about the Institute, and I want to share with you where we're at and what we're going to be focusing on in the next few years. So this is a line that I use a great deal. Every cell is sexed, every person is gendered. And I think it's really, that's something, again, that we tend to take for granted, but it's such a basic fact that we need to bear in mind. Even when people study cell lines, they're studying cell lines that are sexed. Every organ is sexed. Every aspect of our bodies, of our biology is sexed. And these are things that we need to be taking account of. And we haven't done a very good job of that. Every person is gendered. I look out into the room and I make certain kinds of distinctions about your gender based on how you're dressed, how you're appearing to me. You might have a different feeling about your gender, but we relate to each other in very specific ways as men or women, or perhaps something in between. So that's an important part of our social world that we need to be paying attention to and thinking about. So this is my theme that I'm going to continue to be talking about, that every cell is sexed and every person is gendered. So as Sonia so nicely laid out for us, gender really is a social construct. It's something that we make up. It's something that we organize societies. We organize our society in particular ways. We put signs on washrooms so that men will go into certain places and women will go into certain places. And it's an interesting, in different societies, there are different constructions of gender. So for example, in some societies, there's more room for more ambiguous genders, third genders, for example. But in our society, we tend to see our social world structured in very particular ways for men and women. And certainly gender is traditionally linked, particularly in developing countries, to power and to access to resources. And so it's when we think about global health issues, gender becomes a very important construct for us to be thinking about in terms of access to resources for women and their children. It's also been tied to economic and social status, and still is in this country. When we think about the wage gap between men and women, we know that there continues to be, certainly women are earning less for the same type of job than men are, and that's been repeated time and again. We haven't seen a downward trend in that regard. Gender is tricky, though, because it changes. It's culturally specific and temporal. So our concepts of what it means to be a woman or a man in this society are evolving. So for example, what it meant for my mother to be a woman growing up in the 1940s and working in the 1950s and 60s is very different than it is for me. The opportunities are different. What we do, how we engage in society are very different. The expectations are very different. It's tricky, though, for scientists because it is evolving. That means that some of the measures that were developed in the 70s and 80s might not be as current as they need to be for today. And it's a real challenge for the field, for us to be thinking about how to actually grab hold of, measure, think about this concept of gender. As I've mentioned, globally, male has been traditionally valued over female in terms of the way societies have structured themselves. But we also know that men in our society actually tend to die at a younger age and experience many more risks. They tend to access health system much less than women do. And so there are some interesting kind of gendered factors for us to be thinking about paying attention to. So I'm going to argue that gender is distinct from sex, but they're very much linked. My gender identity actually comes from how I actually define myself by looking, for example, at my sexual organs. That gives me a cue about who I am in terms of my gendered perspective. And I'm going to argue, as Sonia's already laid out, that gender has a number of dimensions, a number of things that we need to be paying attention to. So it's not simply a unidimensional phenomenon. And I think that's what we get into trouble with, because we say we're going to do a gender analysis, but gender is just not one thing, it's many things. So what are these things? First of all, as mentioned, it's roles. Now, you might wonder why I have a picture of a woman cleaning the toilet here. Now, I'm not going to make you put up your hands and indicate in your household how many of the women clean the toilets and how many of the men clean the toilets. But the fact of the matter is that many types, the way our work is divided, who takes on particular tasks, what we do are very gendered. And it's important for us to be thinking about this. This actually has implications for the exposures we have in terms of work exposures. There's a particular exposure here. So it's important from a health aspect for us to be paying attention to roles. So roles, they define our dress, our posture, our talk, our occupations, and our access to space, food, money. These are all gendered aspects. And as I've mentioned, are often associated with differential status. And so certain behavioral norms are applied to males and females. And the psychological studies in this regard are absolutely fascinating. For example, in conversation, men tend to interrupt more than women. It's not because that's necessarily in their biology, but it's about how social space is taken up and how one sees one's role in conversation, for example. And these aspects do have implications in terms of health outcomes, in terms of communication, etc. So that's gender roles. Gender identity is separate from gender roles. Again, these things are linked, but this is about how I see myself, masculine, feminine, or somewhere in between. And I think that it's an important aspect in terms of our health as well. There's new work happening in the area of men and masculinity that's really demonstrating that some of the kind of hyper-masculine ideals are very, very unhealthy for men, in that they do create a lot of barriers in relation to health-seeking, in terms of self-care, etc. So we need to understand identity and how it plays out. We know that identity is very much informed by social messaging. The media plays a very important role in terms of how we think of ourselves as men and women, or boys and girls. And again, as I mentioned, it is linked very highly to these sex-linked characteristics. Gender relations is another aspect, and this is about how we relate to one another, how we engage, how we actually engage with one another, how women tend to engage with each other, how men tend to engage with each other based on gendered roles. And we know these types of relationships and responses are very different, and they're important for us to be paying attention to. It's interesting because these notions of relationships obviously intersect with other social locations. For example, one's ethnicity, class, etc. also influence our social relations. And so we can't just think about it as only being gendered, but gender is an important aspect of that. And so when we study, for example, as I've already mentioned, when we study access to health services, an aspect of that is the gendered relation between a primary care provider and a client. And there's some very interesting work happening in relation to what's happening in that interaction, and whether actually having a gender match is important or not, and why it might be important, etc. So gender relations are another aspect of gender that we need to be paying attention to. Now, this is a harder notion of gender to get a hold of, and I refer to it as institutionalized gender. And institutionalized gender really is how gender has seeped into the way we organize our societies, our institutions like our schools, our hospitals, our religion, etc. And I don't think you need to think very hard about this before you start to realize how prevalent this is as well. And there's a little cartoon at the bottom, and there's this one boy. You can tell it's a boy because it doesn't have long hair. There's our gender identity here. And the boy is saying, "Wow, you suck at math." And next it says, there's a boy with a girl saying, "Wow, girls suck at math." And while in this first cartoon, it's really about just one person to another, because this individual suggests because you're a woman, you must suck at math. There's kind of a gendered notion happening there. And we know, for example, that the way our schools were, for example, organized in the 1970s and 80s, girls did perform poorly in mathematics and science, partly because they were the way the schools were organized and teachers engaged with their students created those expectations. Now we have the opposite problem in terms of boys, in terms of the way our schools are organized, are not necessarily taking care of the kinetic needs of boys. And so it's another problem we need to be thinking about, is how our institutions actually respond and are organized and particularly meet the needs of boys or girls, men or women. And you know, the examples are countless. So this is harder for us to measure in our research, but I think it's also very important for us to be thinking about.